Texas on abortion. Texas, a Republican state, is obviously pro-life, as so many Republicans are. Whether this is because of religion is another debate, so for argument's sake, let's just exclude religion when we discuss this issue. Texas HB 2, which is Texas House Bill 2, is an act that regulates abortion procedures, providers, and facilities. It also provides penalties when these laws are broken. So let's look at some of these laws that Texas has enacted. The first one is abortion doctors must have admitting privileges at a hospital within 30 miles of the abortion clinic. This provision will probably result in the closure of most clinics in Texas, since nearby hospitals do not have any incentive to allow an abortion provider to admit patients.
Abortions after 20 weeks post-fertilization are prohibited, except in cases of severe fetal abnormality. The 20-week ban also does not apply in cases where the post-20-week abortion is necessary to avert the woman's death or a serious risk of substantial and irreversible physical impairment of a major bodily function, other than psychological condition, in which case the abortion should be performed in the manner that the physician's reasonable medical judgment provides the best opportunity for the unborn child to survive.
Abortion, including drugs, must be used according to FDA regulations, with the exception that the dosage can be given according to American Congress of OBGYN Practice Bulletin. FDA regulations require that women visit the doctor in person for each of the 2 doses of the abortion pill, resulting in 2 separate doctor's visits.
After taking abortion-inducing drugs, there must be a follow-up appointment within 14 days. This brings the total of pill-related appointments to 3. Of course, the Texas 24-hour waiting period law still requires that women living within 100 miles of their nearest abortion clinic wait 24 hours between her mandatory ultrasound and her actual abortion, meaning 4 doctor's appointments for most women seeking the abortion pill.
Texas abortion law is the most restricting abortion law in the U.S. The closing down of these clinics has resulted in unemployment, as well as some women in Texas feeling their rights have been violated. Clinic operators went to court against Texas in August, as we can see right here. NPR's Nina Totenberg reports, a federal judge in Texas struck down key provisions of the law. Specifically, it struck down provisions that required abortion-providing clinics to spend millions of dollars to upgrade clinic facilities to level of hospitals, and provisions that required doctors performing clinic abortions to have admitting privileges at nearby hospitals. The lower court's decision was overruled by the Federal Appeals Court in Texas. However, that was also overruled by the Supreme Court on October 14th by a vote of 6-3, which temporarily heeded the pleas of clinical operators. The women of Texas, such as State Senator Wendy Davis, who filibustered the Texas abortion bill for 11 straight hours, are outraged by the Texas abortion law. They don't feel it looks out for the woman's best interest and health.